Hello everyone, my name is Wändi Bruine de Bruin and I'm a Provost Professor of Public Policy, Psychology and Behavioral Science. And my research aims to understand and inform how people make decisions about risks that affect their health and well-being. Today, I want to talk about a paper that is about to come out in the Journal of Risk and Uncertainty, and it's on political polarization in US residents, COVID-19 risk perceptions, policy preferences, and protective behaviors. This is a paper I wrote with Htay-Wah and Goldman, and I'd like to thank our funders who are listed at the bottom of this screen. So as you may know, at the University of Southern California, we have been surveying people in the US to understand how they've been doing during the COVID-19 pandemic. Every 2 weeks since March 2020, participants have been reporting on protective behaviors such as mask use, social distancing, and hand washing, as well as risk perceptions for getting infected, dying if infected, and running out of money, as well as many other things. And then in April and May of 2020, we ran a survey that also asked participants about their concerns related to opening the economy. This survey has been conducted with a nationally representative sample. For details on the methodology, I want to point you to a paper that we published in the journal Survey Research Methods. So the present study asks about whether political inclination predicts protective behaviors, policy preferences, and risk perceptions. Just going to show you a couple of results. So here you see the results in terms of political differences in self-reported protective behaviors. One thing to note is that Democrats, Republicans, and independent and third-party voters, that they all, in every group, a majority is reporting that they are engaging in these behaviors. However, we see the greatest political differences in self-reported mask use and avoiding public spaces or crowds, such that Democrats, represented by the blue bar, are saying that they are doing this much more than Republicans, represented by the red bars, with the independent and third-party voters falling in between. We also find political polarization in policy preferences, with Democrats being more likely to say that they're concerned about states opening too quickly or their own state opening too quickly as compared to Republicans, with third-party and independent party voters, again, falling in between. So we find political polarization to be most pronounced in self-reported mask use, social distancing, and policy preferences. And I didn't show this, but our paper goes into more detail and finds that those differences hold after accounting for political differences in risk perceptions and media use. So this suggests that the political polarization is driven by something else, and potentially it's driven by differences in opinion on how to respond to a pandemic. Previous research has suggested that Republicans tend to, for example, put much more emphasis on personal responsibility for health behaviors as compared to Democrats, and are also more concerned about the economy. However, if we want effective pandemic response, and if we want to prevent deaths and illness, then risk communication research suggests that messages should focus on what unites people, that we're in this together as a country, and that we would all be better off if there were fewer people dying and sick. However, risk communication research also suggests that it's important to understand what people's concerns are about implementing recommended behaviors and opening the economy, so that the response incorporates both Democrats and Republicans' concerns, so that we can all get through this pandemic. Of course, that may be more difficult than it sounds. Thank you very much for your attention.